Hi everyone! I am going to be doing a live injection of my Methotrexate and a little chit chat from whoever wants to ask me anything. I just love doing these random ask me anything videos. And if you specifically have questions about Methotrexate, of course, that would be great. Or I just put out an episode of the Arthritis Life podcast all about the best home modifications and adaptations for the home with arthritis. So everything from like stuff to have in your bathroom and stuff to have anywhere else, like, you know, steps to the house and kitchen. It was just covered everything. So wow, 15 people already. This is not the normal time that I go live. So I'm happy to see everyone. So today I do need to do my Methotrexate injection. So I'm going to do that first, and then I will be able to answer some of your questions, or attempt to. I always try to be realistic. So I don't know about you all, but my Methotrexate comes in the little vial and then the syringe separately. So it's unlike the Biologics like Humira, Enbrel, Orencia, Actemra. They come preloaded potentially. This Methotrexate doesn't come preloaded for me. I've heard that there's like an auto injector form, but I really like to inject myself. I don't like the idea of an auto injector. I've actually never tried one. I do feel like I should try one just so I can really compare, because it's just based on my understanding of like what I imagine it would be like. And I'm sorry, Methotrexate, it is, for the record, like on the population level, it's one of the safest, most effective, and most well-tolerated medications for rheumatoid arthritis. But that doesn't mean that any one individual won't have a bad experience. And there are common side effects are nausea and fatigue. So, have I ever had to stop taking it because of an infection? My doctor's pretty hesitant to have me stop taking it. The only time I stopped taking it was for like a surgery. But I've also never gotten like a really bad infection. Like I've gotten a lot of sinus infections, but I've never had like pneumonia or anything like that, knock on wood. So I know that, it's definitely the kind of thing you want to talk to your doctor, because they're going to help you make a cost benefit analysis based on exactly what's going on with you. Because the factors they're going to weigh are how bad is your disease right now, how active is your disease, and because if your disease is flaring up, then there's a more risk of skipping Methotrexate. But if your disease is really well controlled, then it might be okay to skip it. So again, it's going to be a case-by-case answer. And then what's the difference between oral and pill? They're the same exact medication. The reason that some people like me prefer the injection is that it is associated with less stomach side effects. So less nausea, less nausea when you take the syringe injection form versus the oral, because it just goes right into your body. It doesn't have to go through the stomach. But they are the same effectiveness. Hi everyone. Wow, there's so many people. I didn't even give anyone notice. This is like very impromptu. So I'm just going to show you what I do. So I have this little vial of Methotrexate. I already washed my hands before we started the video. And then I have my, it's hard to show all of this in one little tiny bathroom. But and then I have my alcohol wipes. So you always, and I know some people have needle phobia, so feel free to like look away when I do the actual injection. But I know from the feedback I've gotten that for many people, it's really helpful to see someone do it so you don't feel alone and don't feel as scared. So that's why I'm doing it. To me, it's like I have phobias. I have claustrophobia and claustrophobia. So claustrophobia is like fear of small spaces, and claustrophobia is fear of being trapped. The claustrophobia is way worse than the claustrophobia. Like, I don't mind being in a small space too much as long as I know I can get out. It's the fear of being trapped. So I understand phobias. I happen to not have a needle phobia. So you can see I'm holding with kind of a weird grip. Sometimes I try to avoid my thumb because my thumb is affected. I have a little tiny bit of osteoarthritis now that I've had rheumatoid for so long. Sometimes it can also, mine wasn't very well controlled after my pregnancy. And postpartum, I got some more inflammation. And then I also hurt it swing dancing. I hurt my thumb. So so I really try to protect my thumbs. Interestingly, my favorite place to do my injection is my thighs for both my Biologics and Methotrexate. But today I'm going to be doing my stomach because for video purposes, it's just a lot easier. Like, I didn't shave my legs. I don't want to show you all my legs right now. And the needle size for the Methotrexate is the same size as they use for diabetes, so insulin needles. So I don't actually, let me look on here. Does it say, 1 milliliter, 29 grams times 1/2, 0.33 millimeters by 13 millimeters. 0.3 millimeters by 13 millimeters. I don't know if that tells you the answer. I think that does. So half, okay. Yeah, sorry. And so anyway, so, wow, so many questions. I love this. Okay, I have to stop answering or stop scrolling through the questions while I do the actual injection. So once I fill the syringe with the medicine, I'm on the max dose for my weight. Again, I'm 19 years into this, so it's normal to start on a lower dose, like 10 milligrams or 15. I'm on 25 because that's just where I'm at. And so what I'm going to do now is I'm going to do it in my stomach again for the video, because that's not where I normally do it. Because it's a tiny bit, my stomach is just a tiny bit more tender than my thighs. So I have my needle here. I'm just going to shake it a little bit because I got a little bit of medicine on the outside. And so, hi everyone. So this is where if you have a needle phobia, just look away for a second. So I'm going to put the needle down. I'm going to get the area clean by using this alcohol wipe. And I did see that I had a question about where my most affected joints are. I really have the classic rheumatoid arthritis where it's the knuckle joints, which is the metacarpal phalangeal joints of my hands, and it's definitely the right hand more than the left. Rheumatoid arthritis tends to be bilateral, like one of the hallmark signs of it that differentiates it at first diagnosis from like other, causes of joint pain, like maybe just an injury, or a carpal tunnel or something, is that it's bilateral, meaning both sides. So I just got my little alcohol wipe on, and now I just go at a 45-degree angle. Again, sorry for the needle phobia people don't watch, but I have this, it's tiny. I mean, look at how small. I can't figure out how, there we go. If I put my face behind it, you can kind of see. It's very, very tiny. So it truly does not hurt very much. Some of my biologics have hurt a little bit more. And so then when I push it down, I can use my thumb, but when my thumb is sore, I use the palm of my hand. So I've done this on video a few times, but some of you might not have seen it. So here we go. Hi, Dawn. Here we go. And I see Brian, Gracefully Jen. Hello, everyone. So that's it. It's really quick. And yes, I've been on Methotexate since 2003. Hello, Swirl Blaze. I love that name. 29 gauge. I'm sorry, I don't even know how to read. 29G. Yes. 1 milliliter, 29G times half of something. Half. I'm just like, I just do I've been doing it for so long, I don't even necessarily even look at it sometimes. But yeah, I know it's the same size they use for people with diabetes. So I'm going to put my little tiny Band-Aid on, and that's it for the injection part. So I know a lot of people get nervous about injections, but I know so many people now that have had the disease that they do have a lot less stomach side effects, and that's why I went straight to the injections, because I don't have any problem self-injecting, and I do have a history of stomach problems. So just to finish up, then I just put it in the Sharps container. I just started a new one. And so that's that. So let me make sure I didn't miss any questions. But yeah, my most affected joints are both base of the thumbs and then knuckles. You can see they're just faintly pink right now. I'm not in a horrible flare-up or anything. And then the base of my foot. You want to see my feet? It's hard to see, but my toes kind of curl. And it's the second toe, the next one over from the big toe is my most affected toe, and then extending down to like the ball of my foot. So that's one area that can be hurt. How fast are push medicine in? And you try to do it fast because your daughter freaks out. Yeah, you can go pretty fast. I mean, I think it would just, it might hurt a tiny bit more when you go super fast. So for me, it's kind of like a medium speed. Like I don't want to go so fast that it actually causes more pressure. But and if people have phobia of needles, I have a little bit of an unconventional approach, because this is what worked for me with my claustrophobia, is that instead of trying to make your goal to feel good and feel calm and like take a deep breath and you're going to feel good, it's kind of like it's a good idea to actually have like a really realistic expectation that like, I don't like this, and acknowledge that and validate this. Like, I don't like it. I'm not comfortable. It might hurt. And I'm going to do it anyway because it's important. And I know, of course, with children, it's harder to explain that to them. But like, I think it's a lot of pressure to say like, oh, take a deep breath and then it's going to feel better. It might not. You know, there's this theory of exposure therapy that I've talked about with my psychiatrist of like, it's called habituation. And ideally, when you go through an exposure therapy process, exposure therapy is simply a graded experience of exposing yourself to your trigger or to your phobia. And over time, some people end up habituating, meaning like the fear response is smaller and smaller over time. I'm going to do this a little bit so I'm not as backlit. But some people don't habituate. But what they learn to, in terms of like, when I get on an airplane, I've gone through a lot of exposure therapy. And if I could rate my like panic and my discomfort on a scale of 1 to 10, when I first started the therapy, when I would get on an airplane, it would be like a 9. Like, it was really, really high. Now it's like 6 to 7. It's not a 0, right? I don't have the same experience that like a typical person does getting on the plane, but I accept that. It's like this radical acceptance of what you're afraid of. It sounds so weird, but it's exposure therapy based on acceptance and commitment therapy. And it really, really helps me because that's what's ended up helping me more of than those like kind of nice sounding therapies where it's like, oh yeah, just like visualize yourself in your happy place. Like none of those worked for me. It's like the one where you have to just be like, yeah, I don't like this. This is gonna maybe feel uncomfortable for me. And that's life. Life isn't always comfortable. And sometimes we have to do things that are uncomfortable. And so family often is asking, do I get nauseous? Yeah, I'm so lucky because I tend to get any stomach side effect of any medicine except Methotrexate. I don't know how I got that lucky because it's such a good medicine for rheumatoid arthritis. But yeah, I don't get nauseous on it. And I don't know I don't have any secret. I don't do anything differently than anyone else. I take folic acid every day, which is what the doctors all recommend when you're on Methotrexate. It's pretty standard. But yeah, it's unfortunately comes down to luck sometimes. So I'm sorry that you had that experience. Yeah, you know, obviously you can see my hair is very thick, like a half of it's even up and I still have a lot of hair. See gray hair there, I just turned 40. But you know, I do lose a lot of hair. Like there's hair everywhere in my bathroom, but it doesn't have a huge effect on the overall look, so I'm not really worried. Swirl Blaze, you just received the okay to start Plaquenil, hopefully this week. I hope it works for you. Oh, that's exciting. Yes, and I'm glad, yeah. Oh, I'm so glad that it makes you feel less alone. That's exactly my AS diary. AS stands for ankylosing spondylitis, very closely related rheumatic disease to rheumatoid, FYI, if you don't know. Yeah, that's exactly why I wanted to do it, is just helping people feel less alone. And, you know, it doesn't burn, but to answer Tiff Billy Billman, I love that name. It does not burn when the methotrexate goes in. My Actemra, of all the biologics I've taken, biologics are just a different mechanism than traditional disease-modifying anti-rheumatic drugs like methotrexate and Plaquenil and sulfasalazine. The biologics, so Enbrel did not burn when going in for me. Orencia did not at all. Actemra does a little bit, but it helps to take if depending on the medicine you're on, look into whether you can take it out 30 minutes before you inject. That helps a lot for me, but you have to make sure that's okay. Take it out. When I say take it out, I mean take it out of the fridge. So when Tammy Grace, when I was first diagnosed, I was extremely briefly on sulfasalazine. I was having really a terrible gastroparesis flare up at the time. My stomach was really bad. And so I did feel nauseous on sulfasalazine. So I think I might actually, in my chart, it says like a mild allergy to like sulfa-based drugs. So I was then quickly put on methotrexate, which weirdly enough, again, I did well on, even though my stomach was reactive to sulfasalazine. And then I was put on Enbrel pretty quick. But this was in 2003. So the protocols are a little different now. It tends, because the biologics are so expensive, because, you know, according to this article in 2019 in the Annals, I always don't know how to pronounce that, of internal medicine, 50% of people with rheumatoid arthritis do well on just methotrexate alone. So sometimes the doctors do want to try just only having, they call it monotherapy of methotrexate, because yeah, if you can avoid going on extra medicines you may not need, that's good, especially like during the pandemic where the biologics do, suppress your immune system slightly. So Ashley, my right thumb is in terrible pain. Your left wrist and hand is in a cast. How to not use your thumb when it seems I need it for so many things. Only 3 fingers work total right now. I'm so sorry. That's a really severe situation, and I don't know where you live, but you would definitely qualify for to see a certified hand therapist or occupational therapist. So all hand therapists, certified hand therapists, are either occupational therapists or physical therapists that have extensive additional training in the hand. I am not a certified hand therapist, but I am an occupational therapist. But when someone has something that severe going on, I definitely would recommend looking into it. You may need a referral from your doctor in your state, but most rheumatologists have a relationship with a hand therapy clinic. And a few things I would look up one-handed techniques online for what task you're going to be doing. So for example, I just did a video of myself doing using a hair dryer stand. So it goes on your counter, you put your hair dryer in it, and then you can dry your hair. And that's a lot easier to do you can not even use your hands while you dry your hair. So there's things like that, or you can use one hand with the brush. So you can use one-handed techniques. They're often used after stroke too. But again, a skilled therapist, like an occupational therapist, or specifically a certified hand therapist, is the one that could really drill down and they'll do a full evaluation and they'll give you a treatment plan and specific recommendations based on really what's going on in your hand. Wow, so many people. Yes, Swirl Blaze, you have your fingers crossed not to feel so many side effects. Yes. It can be really incredible when the medicines start working. I mean, that's why, I try to show, a balanced view of medications, because there are so many people out there who are anti-medication, and it's really sad because the disease, and I have a bunch of stuff I'm planning on talking about with this in the Arthritis Life podcast and my posts, but the disease is progressive. That's the reality. The disease, if it's not controlled, is progressive. It will get worse. It might get worse faster for some than others, but it is progressive. So the medications are the thing that are the most likely to slow down that progression. And yes, there are risks for them, and I don't want to minimize those risks, but you can't compare the risks of taking a medicine to doing having nothing. You have a progressive disease. So you have to compare, there's a risk of medicine, but there's also a benefit of medicine to slow down the progression. And the prognosis has gotten so much drastically better for rheumatoid arthritis in the last 2 decades since the biologics that I literally have colleagues in hand therapy clinics who are we don't see anyone with rheumatoid arthritis hardly anymore. And so now that doesn't mean there's a certain percentage of people that don't respond well to the biologics and the new meds. And I don't want to minimize your experience, but overall it's a sea tide has a huge change has occurred because of these medicines. So there are people that can do natural methods and have success with that. That's the reality, that some people can have that, but that is not the most common. The most common is to at least blend lifestyle factors with medications. And it's not necessarily an either or, it can be a both and I'm saying that based on the data from the 2019 Annals of Internal Medicine article. It specifically states, I can't find statistics on what percentage. Someone once asked me what percentage of people are able to control their RA naturally. I think it's a little bit tricky to get that data. I have a naturopath. I'm not anti-natural at all. But she's very supportive of me taking Western medicine, again, because she has an autoimmune disease too, and she takes Western medicine for it too, because that's the most effective for her. But she also knows she's also a certified acupuncturist. She's an all-in-one, which is fabulous. But she said, what's hard is that it's the people in her opinion, and I think this is true, it's the people with less severe disease that that group is a self-selected group who is able to succeed with the natural methods. And it's not your fault if you have a more severe form of rheumatoid arthritis. It's progressing quicker. you can't turn back the clock on permanent joint damage. So sorry, I just like went on my long medicine rant. Becca, what can I expect if I see an OT? Will they do an in-home eval? Okay, so wonderful. I really want to do a full episode on this of the Arthritis Life podcast and a full video on this because so unfortunately I've discovered home evaluations are not the norm for people with rheumatoid arthritis unless they're like really severely affected. That doesn't mean that you shouldn't ask for one, but what would typically happen is you'd be seen in person, at least for the initial evaluation, because they need to assess your grip strength, your range of motion, and we have this little tiny measuring thing called a goniometer. I wish I should bring one out, but we literally will measure like your joint range of motion, and that will determine what deformities you have in your hands. Like I do have deformities, but I consider that my range of motion is within functional limits. It's not within normal limits in my fingers, in all fingers, but it's within functional limits. Like I can do most of the tasks in my life unless I'm in a really bad flare. So they look at occupational therapists. Again, if you're doing a certified hand therapist, they are like, have all the gadgets to assess your hands. And they'll look at your strength, your range of motion, and not just in your hands, but in your shoulders and hips. And they'll ask you a ton of questions about like what your day in the life is like what are the things you're having the most difficulty with? Is it opening jars? Is it cooking? Is it taking care of your child or taking care of your pets? Is it your work? Do you need ergonomic things? And then they'll make goals with you and then make a plan of care, which it could be anywhere from 3 weeks to 12 weeks to a year that says come back every week or every other week or once a month. Usually it's every week for like 8 weeks, I would say, depending on how severe things are. And then they would teach you these different life hacks and different exercises and ways to like maintain that range of motion. And fit you, of course, for splints if you need them, recommend specific other like daily living adaptations. And but the whole goal is to help you with daily functions. Like that is our profession. Like I would call it, if I could rename it, that's what I said in the podcast today, the Arthritis Life podcast, I said I would rename it Life Skills Therapist, because that's what we are all about, is your life. What is happening in your life? What skills do you need? How is your disability or illness affecting that? And how can we work around that or improve it? So, Rhea's life, I'm sorry. It is that you're on Methotrexate and Rinvoq and no treatment seems to help. There is like an art and a science, they say. So, some people are lucky like me. My first treatment, after sulfasalazine, I guess technically my second treatment worked really, really well for 7 years. Other people, it takes a while. Someone commented yesterday that it was like their 5th medication that finally worked really well. So there's still hope that you can find a better one, I would say. I'm so glad it's helpful. Yay. Hi, everyone. I'm so sorry. I'm going too slowly through the comments. And Jatel, I understand completely. Lauren saying, my doctor's suggesting I try methotrexate to treat your autoimmune inflammatory diseases. Autoimmune diseases, not RA, that you have in a low dose. For the low dose, the most 2 common side effects are fatigue and nausea. The nausea or the fatigue usually comes 12 hours after. There's like actual studies on that. So, that's why I take mine kind of earlier in the day. And then if I get hit with fatigue, it's when I'm going to go to bed anyway. So, but I honestly, my approach when I'm trying any new medicine is I want to know what the most severe side effects are to look out for, but I try not to think about it too much because there can be a self-fulfilling prophecy where like you're so anxious and worried about the side effects that you actually end up getting a little bit more. Your nervousness can cause nausea too, right? So, the nausea can be very severe for rheumatoid arthritis. For methotrexate, I don't want to like dismiss that, but I also think it's good to not, there's so many people who don't have any side effects. I actually didn't know methotrexate had a bad reputation for side effects until I was on social media groups. I just took it and was like, fine, and there are people who are totally fine on it. It's so hard to find numbers. Literally on the Arthritis Foundation and Creaky Joints websites, it's like 20 to 60%. That's literally what they quote. 20 to 60% of people have side effects from methotrexate. That's a huge range when you're talking millions of people. But, that is the range. So, you might be at least 40% of people don't have side effects. Up to 80% don't have side effects. So the majority don't, potentially, depending if it's 40 or 60. Hello, Carla. And Swirl Blaze, you were recently diagnosed in August and you have continuous pain every day. You want the meds. Yes. Oh, Maria. Hi. Now I know your name. Yeah, I'm so sorry. The beginning stage can be the hardest. Like, it's really about like figuring out what is your new normal, and you don't know yet. You don't know if you're going to respond to meds. So Jenna's saying Methotrexate does make you feel bad for a while, but after multiple years, the side effects have balanced out. You cut out coffee and eat small meals to help your stomach. Yeah. You would like to ask, you have rheumatoid arthritis and now you're pregnant. Okay, yeah. Most people go into remission during pregnancy. Not everyone, but hopefully I've had a successful, I don't want to say the word successful, but like a healthy pregnancy with my son, other than I got gestational diabetes, which was really annoying. S. Swoosh, or S. Swoosh, I have, Humira is the one TNF inhibitor I haven't been on, because what is recommended if you've failed 2 TNF inhibitors, which is tumor necrosis factor inhibitors, which I was on Enbrel and Remicade. Once 2 of those don't work for you, you need to go to a new class of medications, according to my doctor and the research. So I have not been on Humira. It's very common. Lots of people do great with it. Ashley, you've had 4 medication trials in a year, Methotrexate and Biologics. Yeah, I'm so sorry. Orencia, my doctor did say when I started Orencia that Orencia has a reputation for working on people that other medicines didn't work for. So I really am like gently crossing my fingers, Ashley, that Orencia works for you, because it has a different mechanism. It's not a TNF inhibitor. And I will say I was the least likely to get infections on Orencia. Like, I was getting so many sinus infections on Remicade. Again, everyone's different, but yeah. And Jenna, you're saying you tried Humira and it didn't work for you, but the injection was easy, but you did feel knocked out for a day. So that's a good thing to think about, is like, if you're starting a new medicine, I definitely always try to plan my first dose for a time like when I would have the time to, take a rest like on the weekend or something, rather than like a work day. And I want to make sure I see these actual questions. Do you live in USA? Do you have SSI or disability no. So I live in the USA and I'm not on disability because my rheumatoid arthritis is not so severe that I can't work at all. But there certainly are many people who do qualify for disability and Social Security for disability due to rheumatoid arthritis. It is becoming a lot less common now, because the medication treatments are a lot more effective, but it's certainly still possible. And there's a whole discussion, like some people who have rheumatoid arthritis identify as disabled or having a disability, and some people don't, and it really just depends. There's a huge spectrum. Rheumatoid arthritis can be very mild or very severe, so depending on how severe your disease is and how much environmental supports you have, you might feel one way versus the other. So Lav, you have severe pain in your joints, you can't sleep, and you still got medicine. I think definitely telling your doctor that what your status is. And I always recommend, and I need to go in about 5 minutes, just FYI, but telling your doctor in really specific terms, not just I have a lot of pain, or even I'm at an 8 out of 10, but I would say these are the specific things I can't do. I can't sleep more than 2 hours. Really make it specific, because they can't argue with specifics. They might be able to argue in their mind with your perception of your pain, right? Oh, it's not really an 8, it's a 6. But if you say I can't open my car door, I can't open the doors to my refrigerator, I can't, all those specific tasks, most doctors now, there's a whole thing you can look up called treat to target. It's the recommendation worldwide for rheumatology is treating the patient with the target of completely controlling the disease for rheumatoid arthritis, whether that's with medication or other factors. That's the target. We're shooting really high for high function. So if you're not functioning, then they should be able to explain to you why that is. You've tried Cimzia, Orencia, Sulfasalazine, Xeljanz. Is there a specific type of psychologist to see? I wish there was. What I recommend is, if you're in the US, there's psychinfo.com, or is it .org, where you can filter for people that have specify that they have experience with chronic illness. I personally think that the kinds of issues that psychologically come from having rheumatoid arthritis or ankylosing spondylitis, I don't think my therapist needs to have experience with that specific disease, but I want them to have experience with chronic illness in general. And because it is a different thing. Actually, I was even at this World Pain Summit this weekend where I actually spoke. It was very exciting. And the psychologist before me had made a really big point to say, like, psychologists have to treat people with who might have depression or anxiety from chronic illness really differently than the general population, because they're dealing with a chronic ongoing disease. It's not going to go away and may not be cured in your lifetime. Like, that's just the reality. It's not like, oh, you're being depressed about that. You just need to think differently. Like, that's the truth. And so they need to help you cope and adapt to that, not just like pretend that it's not like that. You know what I mean? And yeah, duckle mesh, you take Methotexate, which is working, but your side effects drive you mad. Yeah, I'm not giving anyone medical advice. I hope that's clear, but I have a huge medical disclaimer on everything. But there are some doctors that recommend Mucinex, which is like a cold medicine. I would ask your doctor if they recommend Mucinex to help with this tiredness that can come from Methotrexate. And you're too scared to try any new meds after trying Enbrel. Yeah, that's a really hard one to know. Like, you know, what's that phrase? Is the poison better than the cure? Is the cure better than the poison, or something like that? I mean, I guess for me, there's 10 FDA approved, biologics for rheumatoid arthritis, and for me, like, just my knowledge of the treatments and the prognosis for people on them is that I'm going to give myself the best chance of long-term joint health and inflammation control if I do. I plan on going through all 10 of them in my lifetime, unless somehow each one has worked for me for like a maximum of like 6 or 7 years. So, and I'm 40, so there's 6 left. So I'm like 6 times 6 is 30. Okay. So they better come out with a new one by the time I'm 76. But, but everyone's different. Everyone has the right to, kind of decide what's the right choice for them. Yeah. And so, okay, I'm now, now I've moved to the country. I'm like, I've moved to the country. That's awesome. So you've been on a Methotrexate for 20 years and Biologics now, and injections help. Yeah. Interesting, Jatel. Yeah, you're more tired on Methotrexate, but if you didn't know that was a side effect, you just think it was your new normal. Yeah, I certainly have bouts of fatigue. They seem very random. Again, I always joke, like, if a butterfly flaps its wings in Africa, like, I will sometimes just randomly feel really bad. It's not always necessarily related to Methotrexate. Yeah, okay, I have a couple more minutes. This is so great to hear all of your stuff. And yes, Giselle, yeah, chronic disease distress versus major depressive anxiety disorder treat differently. Yeah, because it is, like, if you have major depressive disorder that's making you feel hopeless about the future and stuff like that, but you don't have any other basis for feeling hopeful about your physical health, then it is like a thinking problem. Whereas chronic disease is like a perpetual unsolvable perpetual problem. Yeah, DBT is amazing, and ACT. ACT is my favorite. So earlier someone asked about therapy. I would look for a therapist with chronic illness experience. I would also really specifically, I'm just saying, I tend to be a really gray area person, right? Try this, try that, do natural, but also do Western medicine, do everything. I honest to God think that like acceptance and commitment therapy for most people that I've met and talked to with chronic illnesses is the most helpful, because it doesn't try to invalidate your feelings. It's all about like accepting what's going on in the present moment. That's the mindfulness piece. But then the commitment and therapy piece, the commitment piece is saying, what's still possible in my life? It's so empowering. You would think that accepting the present moment would make you feel hopeless and depressed, and it can. Like, we all have like millions of emotions every day, but it's empowering to turn your head away from just like, I have to fix it, I have to cure it, I have to heal it, and just say like, what can I do? Like, there are still, like I always say, like, unless you're in a coma, like, you have a lot of options. It doesn't mean that you should feel bad about feeling sad about what's going on with your health, but like, it means that like you have choices of where to turn your attention. And I think that acceptance and commitment therapy is so helpful for that. And then, yeah, so so every time anyone asks me what my thoughts are on biologics, I'm like, oh my gosh, have I not made this clear enough? Biologics are amazing. It doesn't, on the whole, across, like, on the population level, this is to be careful, right? Like, the population level means when you take the population of people with rheumatoid arthritis, 2 million people in the US, 2 to 3 million, it is biologics have completely changed the prognosis of rheumatoid arthritis in a positive way. But that does not mean that each individual has success on them. When you look at yourself, you might not do well on biologics. It doesn't, I wish I could tell everyone that because it works on the population level, it guarantees works on you. I mean, I hate to mention the big V word, like vaccines, but it's kind of the same. Like, it's very rare, for vaccines to have a side effect, to have a adverse reaction, but it can happen. And I think for biologics, that's the same thing. We have to acknowledge that reality. But I think the most important thing, I know I sound like I'm very biased when it comes to biologics, but it's just literally the data. If you're confused about biologics and scared about them, I think the most effective thing to do is look, and I have videos on this, I can just send me a message and I can send you the videos. Look at the history of what life was like for people with rheumatoid arthritis before biologics and compare that to now. I really think that's your answer. I don't think that you can conclude from, again, the population level that biologics are worse than before we had biologics. Again, rheumatoid arthritis is a progressive disease associated with a shortened lifespan of 7 years. And so my headphones are sounding like as if I'm suddenly, no one can hear me. But so the inflammation associated with rheumatoid arthritis is what causes a more likelihood of having heart disease, more likelihood of having heart disease, which is then decreases your lifespan. So it's a really, really serious illness, and not to make you like depressed about it, but that's the reality. Biologics are the thing that of anything in the last 2 decades has suddenly stopped that progression for many, many patients or slowed it down considerably. Again, that doesn't mean that you might be one of the rare people that has a really bad reaction to it. Like, I have a friend who got tumors from her biologics as a side effect, and that really, really sucks. And that's an individual thing that can happen. It's kind of the same as like pregnancy. Like, if you want to have a vaginal birth, like, you can do everything you can, but you might still end up having the C-section. You might have 90% of people can do the vaginal delivery, and you might have to have a C-section because of things out of your control. But with the biologics, it's just, for me, it's a no-brainer. But I totally understand that other people feel differently, but it's, for me personally, I'm saying, not telling everyone to take them, but it's it would be irresponsible for me not to explain to people with the platform I have, how important biologics are for the general population of people with rheumatoid arthritis. In fact, that's why Facebook groups and Instagram groups can be a little bit deceptive, because you think that you see all these people on the Facebook groups who might not be doing great, and you might think, oh my gosh, everyone's not doing well. There's so many people right now who get diagnosed with rheumatoid arthritis and go on the biologics, feel amazing, and barely even identify as somebody with rheumatoid arthritis. That's honestly was my life from 2003 to 2009. I didn't really even think, I didn't talk to the Arthritis Foundation. I didn't think about my arthritis that much. And again, and that's not super rare. There's a lot of people who have that. I don't know the statistics, but I believe last time I heard 70% of people respond well to the current modern medicines, and that's way higher than in the era before them. So, sorry, that is my thought. Hi, Kat. Okay, I have to go in a couple of minutes. Is your doctor okay to say... Oh, so the thigh is I don't actually know why they would say the thigh is the best. I prefer the thigh, just it's awkward to do the thigh in a video, especially when I haven't shaved my legs, so that's just why I did the stomach. And I'm glad, yes, some people were saying that they've been on Enbrel and it's working. And Kat, yeah, you need your biologics and your disease is still active, but you're grateful for having anything to help, And biologics it's not something that stays in your system forever. If you don't end up liking them, you can go off them, honestly, what some doctors are saying is it's the irony is that the people, if your goal long-term is to be able to control your rheumatoid arthritis naturally, without prescription medicines, you actually have the best chance of doing that by going on the medications early, because the people who are aggressively treated early stop the progression of the disease, and then they're able to slowly wean off the methotrexate and or the biologics. But it's not intuitive, and I totally get that. You asked your consultant for biologics, and he said you're in remission using Methotexate, you need to stay on that. Oh, that's a hard one. Yeah, okay, Simsia, yes, crossing fingers it works. And sometimes the decisions are made by insurance companies in the US, and I hate to say that, but that's just the reality. So, it is, and I also think doctors do have to operate from an assumption of a logic of first do no harm, because biologics, they do suppress your immune system. Again, it is like a cost-benefit analysis. So if you're doing well on methotrexate, I can see why they would say that. Again, I'm not a doctor, but anyway, thank you all so much. I'm going to put a video of this up, but I need to go. But if you're watching the replay, just ask any additional questions in the comments. Oh, and don't forget to listen to episode 47 of the Arthritis Life podcast. My friend Lindsay, who's an occupational therapist, and I talk about every one of our favorite home adaptations and modifications for arthritis. So it is really a practical, chock full of tips episode. So don't forget to catch that. So if you have any questions, thank you all. It was really fun. I didn't know if anyone would come on because I didn't even announce it. So that was really fun to answer your questions. Okay, we'll talk later. Bye.